Mohawk Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to the show Fight Against COVID-19. I'm your host, Dr. Shefali Agarwal from Boston. Thank you for really airing on the show and listening to us. This is a show that highlights many people who are working and trying to fight against COVID-19. We have people who are either making masks, we have people who are helping people who are hungry, we have people talking about how they're supporting small businesses, and we have people who are in the front line and treating these COVID 19 patients. It's an amazing journey because we have talked to many people across the states, across boundaries, and have come together as a community, both in frontline and both helping behind the scene. Today, I have a frontline hero with us from Boston. He's a doctor, Dr. Anil Jha from Lawrence General Hospital in Boston. We are very excited and honored to have somebody who's working directly with COVID patients who will talk to us today and help us understand what's going on and how difficult this disease is. Thank you so much and welcome, Anil, to the show.
Thanks for having me.
Of course. So, Anil, before we move on to COVID 19, I would love to talk about your family. Tell me a little bit about your wife, your kids, and then we can go on and talk about other things.
Yeah, sure. So as I'm Anil Jha. I work in Lawrence General Hospital. We are a two-physician family. My wife is also a doctor. She's a pediatrician. And I have two kids, 6-year-old and a boy and a 2-year-old girl. So, pretty busy at this time, given we are staying inside.
Yeah, that's right.
Yes.
I can understand.
Right.
That's amazing. So you said that you're a doctor in Lawrence General. So tell me a little bit about what you do in Lawrence General. And before I start, I do want to tell the viewers that whatever Dr. Jha is going to talk about is his opinion, not the opinion of the hospital. So I just want people to understand that. So let's start with, tell me a little bit about what you do in Lawrence General.
So I'm a hospitalist, and even a further step, I'm a nocturnist, which means I work nights in a shift-wise duty. So I, as a hospitalist, we take care of the patient who are admitted in the hospital. It's just something like your inpatient primary care doctor, basically. What I say generally to my patient. So you have a primary care doctor who takes you when you go to their clinic, and assess you, and if needed, they say, okay, you need admission, go to the emergency department, or directly they send some time to admit the patient in the hospital. And then we take care of, from there, we start to take care of them until they get better. So we are the primary caregiver once the patient is inpatient. And then we also seek advices from different specialty, if given like what's the need. So assessing that needs, and then we kind of, get help from them. And we kind of, overview everything and then decide when the patient is better and can go home. And then we coordinate with their primary care physician that this happened during this hospitalization. And from here, we need to follow these things and go from there. So that's kind of a cycle we are part of.
So you must be then in the front line right now seeing COVID patients. Tell me a little bit about what is going on and how these patients come. What are the symptoms? What happens in general?
Sure. This is, it's such a variety of presentation for these patients. Sometimes they just come for some different, like because this is primarily respiratory tract infection, disease. But we see patients who are coming from different things, maybe a diarrhea or maybe a headache or something, and we test them because generally we are doing tests for each suspected patient, and they come positive for that. So from there, versus some just come walking there, we have like a outside hospital. We set a tent there for testing, and they just the symptom less, and they just come there because they think that they're exposed to the disease, and we test them too. And versus some patient who is really in a big distress, they're not able to breathe, their oxygen level are really low, and needs like urgent intervention, including intubation, putting the tube in their breathing pipe, and help with a ventilator, which is the machine. Like nowadays, everyone knows what exactly that is, that help you with the breathing. So is it from walking to really not a very, very sick patient we are seeing.
So, as we see in the news, and of course, the Boston, Boston has cases. So you
Sure.
see cases currently, COVID patients that are under
Yes,
care. Yeah.
yes. Still, we are seeing cases, yeah, which are like already positive, sent home, to monitor your symptom, and they are coming sick versus new sick patient where they were never got tested. So
Yeah.
still, we are
So,
seeing those
one
numbers.
thing that we are hearing, of course, that there are multitude of symptoms, respiratory symptoms, you have
Hmm.
fever, you have, cough and cold, sore throat, like flu. But then on the other hand, you're also seeing things like loss of taste, loss of smell, and
Yeah,
other things,
yeah,
right? So
yeah, yeah.
it's variety of symptoms, right?
Definitely, yes, including headache, body ache, just like simple flu-like symptom, nausea, vomiting, diarrhea. Some patient come with like new onset seizure, like so
No.
and there was no concern at all, and then they tested positive. So there's multiple like
Multitude of.
yeah, yeah.
So I think, like you said, that we also hear that I mean, of course, as being a physician, I understand that there's
Hmm.
testing set up for people who actually have a risk of exposure because they have contact or things like
Hmm.
that. So basically, they believe that they could be exposed, or some with symptoms that you need to test anyway, right?
Sure.
Uh, in terms of a lot of people actually, like you mentioned, that they get tested but they have no symptoms, and they are sent back and said you quarantine yourself and try to how what is that basically scenario, how does that work?
So generally, given the patient is either they have some very mild symptom, and you know there is some other like maybe you're expecting something else in them, given the test kits and availability of test is limited, so we have to make sure that we're using it wisely. So sometimes and if the patient is agreeable and we feel that it's safe to send them in a quarantine for
14
2
days.
weeks, yeah, and then from there we can monitor, or they can call us in case that things are getting worse. So this time we are kind of trying to just um, uh, creating a traffic for a sicker patient to our hospital getting
Sure.
use the test
You have to
there.
manage it wisely,
Yes,
right? Yeah.
yes, yeah.
So tell the viewers a little bit about, we hear a lot about ventilators, intubation, and things like
Hmm.
that. Can you explain a little bit to people who are, maybe understand it, but really have heard it in the news, but really don't understand it?
Sure. So basically, generally, like indication of that, what we call, the need of ventilator arises when you are not able to breathe. Your lung is basically not working what it was supposed to work, which is the prime organ which helps oxygenating the blood. So getting the oxygen from the environment, mixing with the blood, and sending the pure oxygenated blood, then it's sent to the heart, and from the heart it goes to the different part of your body. So this exchange of the carbon dioxide and oxygen that happens there in the lung, and that's a normal process. We generally even don't like know how many times we breathe, and everything is going normal. But when your lung is not working because of any cause, and the COVID is, well, like a respiratory tract illness, and what it is doing in the patient who require this ventilator, that it's all these immunological reaction in
Changes,
your
yeah.
changes there that causes lots of inflammation in that all those small like unit of the lung where this all these gas exchange happens. So so now the lung is not able to do that's prime job, because it's lots of like either a fluid or all these yeah, mostly like fluid is there, so it's not able to do because the structure is changed now. And to overcome that, we have to support that patient until it's this all this immunological reaction it's is taken care of the body. So give that time to reset everything, or coming recover from that. We have to support the breathing, and this ventilator come there, so we have to put a tube through their mouth which goes in there, what we call trachea and the bronchus, which is basically just like a food pipe. There's a I would say air pipe that goes in the lung that connect the lungs, both side of the lungs. And so this tube stays there, and that's the one part of the tube goes to that machine, which we can set parameters there, like rate of breathing, how much oxygen it will need, how much pressure to push that air into the lungs. Those things we can, adjust there as the patient, because this is like the need of each patient is different based on their physiology. So we have to adjust that. And with this machine, we'll able to give adequate oxygenation until the lung will take over again. So that's kind of this ventilation. And how we know that, generally you will be feeling very short of breath, like really like, hungry for air. Your generally the EMS says that at home, if the patient is coming from the home, they are in 70s, 80s. That's the oxygen percentage, which should
And
be
what's
like
the normal, Dr.
sure. So it should be like the good number is 95, above
Okay. So
95%.
you're about 70, then it's very
Yeah,
low.
it's really, yeah. Normal for me, it will be 98, 99, 100%. That's good number. But even 95 and above is acceptable. But yeah, I'm seeing patient with 70%, 80%,
That's
so
very low,
which
yeah.
is really low, and the body cannot survive. I will say like couple of hours. Because that's again, there's a different chain reaction will start from there. So we need to recognize that, and we need to do something very urgently to take over.
Something that I've heard a lot when I'm reading about is like what you say, cytokine release, basically all these inflammatory things that come because they're trying to fight this virus. But that can actually cause a harmful effect by,
Yes.
attacking your lung. And we are
Yeah.
also hearing some of the patients actually having attack on kidneys and going on dialysis.
Right.
Is
Right.
that,
Right.
yeah.
It's a multi-organ, like kind of disease. It's kind of if the patient is sick, it's affecting each and every organs. So definitely kidney is one of them. Then heart, we are seeing a lot of troponin leak, which is one of the cardiac enzyme. Which, if the heart is under stress or is a cardiac what we call is a heart attack, then generally we see that, and we are seeing in these patients. We are seeing even strokes in patients as well. And the theory behind this so far is that it's a kind of making a lot of thrombus in your body. It's
Yeah.
making your
Which is a
blood like
clot, pretty
thicker,
much.
clot,
Yeah.
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 And so your body is more prone to getting clots in this. This is another thing, lung clots everywhere basically, and that's causing all these multi-organ
Problems.
as well as all these immunological reaction. So
So
it's
how many COVID patients do you see? I mean, I think it's quite
yeah.
quite. I mean, I don't want to
I
tell you
mean,
number, but quite a bit, right?
right. I
Generally.
mean, like it's a lot. Like I would say, like most of our patient at this time, it is still there. We are seeing normal patients as well, which is like again comes as question of COVID. So basically, we are treating everyone as a COVID until proven otherwise.
Yeah.
But then some of the patient are still like normal illness. We are seeing them as well.
So I think I want to first tell you and thank you from this show, and I think everybody is viewing and everybody around that what a selfless work you're doing. It's very hard to actually risk your own life, your own family, and go there and help people in need. So thank you so much for that.
Thanks a lot.
It's really, we talk about saying that the frontline warriors, and that's what you guys are, directly in risk with these patients, but you're not caring about your own lives and being there. Tell me a little bit about what you think when every day you go, and of course there's a risk to your family. What are the feelings?
Uh, like still for me it's a normal day. I have to be there. I'll be there. Yes, the in front of me it's a different scenario, which I used to see is totally different there. And the thing is, it's hard to. It's still we are learning, and that part is not very helpful because we have to. For us, it's this is a disease I have to treat. These are our option here. That
There are
part
no
is missing. It's
treatments.
still missing. Yeah.
Yeah, yeah.
So I mean, like, for
So
going to job.
you hear about these treatments like
Yeah.
antibiotics and antimalarials and things like that. I mean, I
Yeah.
know that they are not proven and end up being
Yeah.
in clinical trials. I mean, they're
Yeah.
still not proven, right?
Yeah. Hydrochloroquine is kind of out of the picture at this time.
Yeah.
Remdesivir is still some trials are going, but I mean, like, we
Still need
cannot
to
say.
find
Yeah,
more.
still need to
Yeah.
find out before we rely on that. Another is the tacrolimus is another one, which is again it is work at the immune level of the body, which is still kind of need more data to support that, but we are using that. in like sicker patient to get some result there, but still more data needed. So like plasma donation is something currently
Yeah,
is
tell me a little bit about
yeah.
plasma donation, please.
Still, again,
What
not
is
much
it
data.
first for people
So,
who don't
so,
understand?
so
Yeah.
first it is so basically it's kind of a very fast way of vaccinating. So what we do in vaccination, we give small dose of that disease to so that your body will react to that and make antibody. So the next time you're getting that virus or something, you have the weapon to basically fight that. So what we are doing now that the body we are helping or we are giving that made antibody from a different person which already got infected and made that antibody in their system. Now we are using those antibodies to the sick person so that that will neutralize the that antigen, which is the basically disease particle or the virus. So this way we are doing it's a little bit faster. So again, we have very
Is there a
limited.
time frame, Dr. Jha, that once you get this infection, how quickly you have to get the plasma donation done and basically give it to the other person?
I mean, like, so it's basically you need to be symptom free. You need to be like 28 days. That's we are kind of like, going for at this point. After that, you will able to
Donate.
donate.
Yeah.
Yes. Yeah. And then they need to be like matched donor and, all those stuff is
So there
still
are
needed.
multiple things that you need to be checked
Yeah. Need to
before
be
you say you're
checked. Yeah.
eligible. Yeah.
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 Yeah. And then basically, so I think very limited data on that. I think UMass is doing one and Mayo Clinic is doing one research, but yeah, again, we
We
have to
still
wait
need to
until we
gather more
get, yeah,
data. But
right.
I'm hearing that FDA is allowing some of the compassionate use plasma donors, and they're saying basically you could use in sicker patients to test, right? It's
Yes,
not
yes,
proven yet, but they're still
yes,
using it.
yes. Yeah, yeah. And definitely it's basically we are, whatever we think in like scientific, I will say in, understanding that will work, we should be doing. And this is one of them that might work and give us some good result.
So, like antimalarials may or may not, right?
Yeah,
You have some antibodies, you have some antivirals,
right.
you have plasma donation. So that's what we
Hmm.
have today
Right,
for now, but still
right.
need randomized trials to be proven
Proven.
anyway.
Yes.
What else is like symptomatically? So, ventilation and basically keeping people like helping in fever and things like that, right?
Sure, sure. So Tylenol is the what we give for fever because that's one of the very prominent symptoms. 98% people are having as a fever as a symptom. So there was a concern that NSAIDs, which are our like Motrin and all these medication, are harmful and they are making this disease serious. But recent data showed that there is kind of you can use that as well for the as a for medication for fever. So that's kind of one of the thing. Then other thing is generally in illness, that when patient is not able to eat, drink on they are on the ventilator and all, we have to make sure that hydrated enough and we give IV fluid. In this disease, we're avoiding that because we are seeing that the heart is most of the time is not able to pump those extra fluid.
Yeah, yeah,
So we are keeping them on a more like a drier side until it's
yeah,
absolutely necessary. So that's
yeah.
another thing we are trying to avoid.
So, the main, what I believe is the main answer one day will be
Hmm.
vaccines. And I know a lot of
Sure.
Gilead and other companies. How will a vaccine will be more prophylactic, like, right?
Right. Yeah, it's more like a prevention. Yeah,
Yeah,
just like what we are doing for the influenza these days.
yeah,
So, we are hoping that something similar or, efficacious we will able to develop.
yeah.
It's a long process again.
Right, right. I think
Yeah.
I know that people are working very hard around
Yes, yes,
the
yeah,
world to try to
multiple,
get
yeah,
to get the
multiple like
vaccine.
countries, multiple drug companies are working on that. Hopefully, we'll get some good result.
Yeah. So, what would you tell the viewers? What are some of the guidances you will give to viewers in terms of first what they're doing at home, and the second is if there's symptoms, what do they do?
So we know, like at this point, everyone knows how to, what to how to prevent it. Basically, social distancing, hand hygiene, you wearing mask when you are in a public place. If you need to go, you should be avoiding. But if you need to go, at least using that. So these are more like a prevention.
Or
And then
hand washing, social
yes,
distancing, and
social
making sure
distancing.
that you wear mask. Yeah.
Wear a mask, yeah, when you're in the public places or going to a grocery or something like that. So yes, and then I think now we know that all these symptoms exactly how the patient are presenting. So keeping an eye on that. Again, I will say like fever is one of the most like prevalent symptoms. Sore throat is another, like people are experiencing a lot at the early phase of disease. Headaches, body ache, diarrhea is also kind of comparably is more common in patient. Not much abdominal pain, but yes, I think these are
And
which we are
now
getting.
they're saying that if you lose smell or
Yes,
those kind of things,
anosmia. Yes,
yeah,
anosmia
anosmia
and
and
discuss.
right,
Yeah, yeah,
yeah, yeah,
that's a scientific term for
yeah,
loss of smell
right,
and
right.
taste. Yeah.
So if there are symptoms, those they basically contact their primary care or try to go to the to get tested, ensure that, right?
Yes, yes, definitely. You call your primary care doctor, and they are, I think, available. Everyone is available via, telemedicine these days. So they will guide you from there. If you need a test or just to watch your symptom, stay away from your other family member who are not showing any symptom. Just to, if it is COVID, we need to stop it there.
Yeah.
So definitely, and then testing. Although the test again is the what we are doing currently with the
Yes.
taking a swab from the nose and sending it to the lab. 30-40% time is still negative, and there is a chances you still have. So
Yeah.
you have to watch the even it's negative. Keep that 2 weeks time at least or
Yeah.
3 weeks time and monitor your symptoms. Once it's in the a little bit advanced time frame, you will be like more like short of breath or you feel weak. My like a couple of steps you will feel short of breath. These are the symptoms people are kind of
You have to be careful about.
yeah, be careful. And definitely don't wait until then. You go to your nearest ER or call them before going there, and they will do help you from there.
Yeah. So I think the two tests are basically to find there's a virus or not, and an antibody test. And I think they
Yes.
still try to figure out the basically how
Yeah.
how that will be helpful still, right?
Yeah, that will be more like when we are, more like open phase. Then it's more like who already got infected.
Right.
The use of that, test. So for now, it's more like the PCR, the main what we are doing through the taking from the nasal swab is the main test to diagnose here. When in the early phase, these tests are more like after some time when you are. I think recently the New York did some tests, and they are saying that around more than what they expected, more than that the number of people are already infected and got kind of better and without having any symptoms. So that's kind
Yeah.
of
Yeah.
that's
And
a
also, we are
yeah,
hearing some news about reinfections that they actually got
right,
infected. There are
right,
the antibodies and they got reinfected. So it's
reinfected.
still a lot to find about this
Yeah,
virus. There's
yeah,
a lot.
it's not behaving in a normal pattern. So that's
Right.
really
It's
very
hard to
very
say
yeah.
what. Yeah.
Making a
So
pattern is not possible with this
yeah.
so far. Yeah.
Are you are actively treating patients, COVID patients right now, right?
Yes. Yes.
Yes. So, it's amazing, how you are actively there in front of
Mhm.
this whole situation. Uh, are people scared when they come in? What do you see? Like, I'm sure there's some emotional or psychological factor to this, not just medical as well.
Yeah, I mean, like definitely the fear of this disease is like globally at this point. There's everyone is definitely scared. Then who are sick and I mean, like these days there is no hospital visitor policy. So definitely there is a mortality rate is high and people are well aware about that, and they are kind of like if they have any other risk factor, they are very that's make them at the more
And
like at
lonely,
more
right?
risk basically. Yeah, and then you are not able to see your family members until you are better again. That part is really very
Major.
stressful and yeah, emotionally really overwhelming for everyone. And we experience that thing, and we try to help everyone as much as we can via video call. And um, but again, it's not like seeing them physically being there at the bedside. It's
So,
so
Dr. Jha, I want to really thank from all the
Yeah.
viewers and all the people who are watching the show. And of course, I hopefully that many people will watch this. What a wonderful job you're doing. What a selfless job you're doing.
Thanks.
Putting your life online and helping patients, and not just medically, but also emotionally when they're lonely. Because, as they say, it's a very lonely disease
Yeah.
and it is tough to deal with. So being there as partners for them, and not worrying about your own families. And thank you so much for doing such a wonderful job from the bottom of our heart and from My Dream TV and everybody here. So again, really a pleasure to have you. Any message for the viewers before you go?
I will say, yeah, stay safe. It's really tough time. Um, Physical health is important, but mental health is also so very important, I will say. And it's a time where it's hard to, in the confinement, it's really hard to keep yourself, at normal functional level. So I will say take care of that too. Yeah, I mean, like, yes, and definitely we are there, and everyone is working hard to take care of this. Hopefully, we'll have more answer. But yeah, I mean, like, take care of yourself, and we are
So,
there for you.
from us, you please be safe. Just
Sure.
take care of yourself as well as you're
Thank
taking
you.
care of
Yeah.
others too. And thank you so much, Dr. Jha. Have a
Thanks a
very
lot.
good night. Thank you again.
Thank you. Thanks.
Bye.